Important notice. This video is provided for informational and educational purposes only. It does not substitute professional medical advice. Did you know that some signs of brain cancer can be mistaken for common, everyday symptoms? Today, we'll show you the 10 main signs of brain cancer so you can recognize early indications and seek medical help as soon as possible. Stay tuned until the end, because your health might depend on it. Don't forget to like the video, subscribe to the channel, and turn on notifications so you don't miss any health tips. Brain cancer can manifest subtly or significantly, affecting everything from cognitive functions to body balance. Identifying early symptoms can make the difference between early detection and future complications. In today's video, we'll explain the 10 main signs of brain cancer, detailing how they appear and why they should not be ignored. Sign 1. Persistent headaches. Persistent and unusual headaches are one of the most common signs of brain cancer, especially if they worsen over time. These headaches tend to be more intense in the morning upon waking or after activities that increase intracranial pressure, such as coughing, sneezing, or physical exertion. Unlike regular headaches, they don't respond well to over-the-counter pain relievers and may be accompanied by symptoms like nausea and mental confusion. Pay attention to the frequency, intensity, and pattern of these headaches. If they persist and are out of the ordinary, consult a doctor for evaluation. While they may have other causes, addressing them promptly can be critical for early diagnosis. Sign 2. Unexplained nausea and vomiting. Unexplained nausea and vomiting can be an early sign of brain cancer, especially when there's no apparent cause, like infections or stomach issues. These symptoms often occur due to increased pressure inside the skull caused by tumor growth. They may be more intense in the morning and, in many cases, don't improve with common nausea medications. Additionally, they might be accompanied by other signs such as dizziness, persistent headaches, or balance problems. While nausea and vomiting are common in many conditions, recurring episodes without a clear reason or their association with other neurological signs demand immediate medical attention. Early diagnosis can make all the difference in treatment. Sign 3. Vision or hearing problems. Sudden changes in vision or hearing can be a sign of brain cancer, particularly when they occur without an apparent cause. Tumors pressing on specific areas of the brain, such as the occipital lobe, responsible for vision, or temporal lobe, related to hearing, can lead to symptoms like blurred vision, difficulty seeing peripherally, flashes of light, or even partial or total vision loss. For hearing, symptoms may include persistent ringing, tinnitus, trouble hearing sounds, or even deafness in one or both ears. These issues may also be accompanied by dizziness or trouble pinpointing sounds in the environment. Since these symptoms can also indicate less severe conditions, consulting a doctor for accurate evaluation is essential. Sign 4. Personality or behavioral changes. Sudden personality or behavior changes can be a sign of brain cancer, especially when they affect brain areas related to emotions, judgment, or decision-making, such as the frontal lobe. These changes can present in various ways. A usually calm person may become irritable or aggressive, while a more outgoing individual might become withdrawn or apathetic. People may also struggle with everyday situations, show a lack of empathy, or have disproportionate reactions to ordinary stimuli. Confusion, disorientation, or unexpected impulsivity may also occur. These changes, even when subtle, should not be ignored, particularly if they progressively worsen without clear explanation. Seeking medical evaluation is crucial to investigate the cause. Sign 5. Memory and concentration loss. Memory and concentration difficulties can indicate the presence of a brain tumor, particularly if these changes progress and interfere with daily life. Individuals may begin forgetting recent events, appointments, or important information that was once easy to recall. Additionally, tasks requiring focus, like reading, following conversations, or solving simple problems, may become increasingly challenging. This cognitive decline occurs as the tumor presses on areas responsible for processing information and memory. These signs may be subtle initially, but their progression warrants serious attention. Consult a doctor for a proper and timely diagnosis. Sign 6. Weakness or numbness on one side of the body. Weakness or numbness on one side of the body can be a critical sign of brain cancer, especially when it occurs suddenly or persists. This happens when a tumor presses on areas controlling motor skills and sensation. Individuals may struggle to move an arm or leg, have difficulty gripping objects, or experience changes in coordination. Numbness may be accompanied by tingling sensations. These symptoms, often resembling those of a stroke, should never be ignored and require immediate medical evaluation. Sign 7. Seizures. Seizures are one of the most alarming signs of brain cancer. They occur when tumor growth irritates and disrupts the brain's normal electrical activity. Seizures can range from mild episodes, like brief involuntary movements of a limb, to severe episodes involving loss of consciousness, muscle stiffness, and generalized spasms. Even without a history of seizures, a brain tumor can trigger these episodes unexpectedly. Seeking immediate medical help is crucial if you experience a seizure, as it could be the first indication of a serious condition like brain cancer that requires urgent diagnosis and treatment. Sign 8. Slurred speech or difficulty speaking. Slurred speech or trouble speaking can indicate a brain tumor, particularly when it arises suddenly and without explanation. This difficulty occurs when the tumor affects areas of the brain responsible for language and articulation, such as the frontal or temporal lobes. Symptoms include slow speech, incomplete words, or trouble finding the right words, making communication challenging. In severe cases, speech may become completely unintelligible. This sign is often accompanied by other symptoms, like memory loss or mental confusion. Persistent problems like these should prompt an immediate medical evaluation for thorough investigation and treatment. Sign 9. Excessive sleepiness or mental confusion. Excessive sleepiness or mental confusion can be a concerning sign of brain cancer. Tumors in the brain can press on areas responsible for alertness, disrupting the sleep-wake cycle. This symptom often results from increased intracranial pressure, reducing blood and oxygen flow to the brain. Affected individuals may appear disoriented, forget daily tasks, or struggle to maintain coherent conversations. Persistent symptoms like these require immediate medical attention for detailed neurological evaluation and imaging tests. Brain cancer is a serious condition, but recognizing the symptoms can save lives. If you or someone you know exhibits any of these signs, seek medical advice immediately for evaluation. Don't delay in taking care of your health. Did you find this information helpful? Leave a like, share it with someone who might need it, and subscribe to the channel for more health tips and insights. Remember, taking care of your health starts with knowledge.